next to perform is the inguinal area. So the locations of the inguinal area, it's around, it's on the thigh. Okay, on the, this is the lateral and this is the upper thigh of the patient. So if you're going to check the inguinal area, alright, so in this one, okay, the groin or the inguinal area, this is very important to assess the inguinal area to check if there's any possible signs of inguinal or femoral hernia. So as we all know that the hernia, it is the abnormal protrusions of the intestine, okay, down to the scrotum, right? So it might be painful. So in this one, so in check this is we need to, right, to insert, okay, our fingers, right? So directly this upward on the side, okay, to check if there's any presence of bulging or protrusions. Okay, so the patient might feel what you call this, uncomfortable or pain. So in that case, so we need to ask the client, or we need to advise the client to have it checked further to the doctor or to the physician. So in this case, all right, so there's no any signs of possible inguinal or femoral hernia. So my client is in the normal or findings. Okay, so after that, okay, you have to ask the client for further examinations or assessments with perineal area. Alright, so in the anus and the perineal area, so in order to visualize that area, so ask the patient if the patient will permit you, okay, to assess the anus and the perineal area. Of course, we need to check, of course, if there's any presence of ulcers, lesions, discharges, if there's any lumps, or if there's any masses that is palpable, right? So with that, you need to document it, and of course, you need to check the sacrococcygeal area to check if there's any presence of course, there's discharges, swelling, redness, if there's any ulcers, and of course, you need to palpate for anus sphincter tone. Okay, you need to palpate the sphincter tone. Okay, to check that the tonicity. Okay, as we all know that this area has to be a strong muscles because it used for a control, you know, during the defecations. Right? So next is, after that, you need to check the rectum and prostate. Okay, palpate the rectal mucosa, and then palpate the prostate gland for tenderness. Okay, then, so in this case, there's no any abnormalities, unusualities, so there's a normal findings. Okay, so the penis, okay, by checking from the base, okay, the foreskin, right, the mons pubis, okay, the glans penis down to the scrotum. Okay, there's no any abnormalities in the femoral area by checking if there's any sign of inguinal or femoral area. So of course, the anus sphincter and the perineal area, and the rectum and the prostate. So in this case, so the client has a very normal findings. Okay, so after this one, you need to ask the client, okay, to get up or to fix everything, and advise the client for further. Advise the client to wait for the remarks or the result. Okay, the outcome of the assessment, and then you need to explain if there's any abnormality. Ask the client to be referred to the for further examinations. So after that, so you have to take off your gloves and then do hand washing as per hospital infection control or policy, and then do a documentation, then formulate collaborative problems. So that's it. So that's my assessment for the male reproductive organ, scrotum, the penis, checking the inguinal areas, the rectum, the perineal area, the anus, and the prostate gland. So, thank you so much.